This is Caitlin, and Caitlin is a young mom of 2 children. Her oldest is 2 years old. Her youngest is 4 months. Her first child was delivered vaginally and her second by a C-section. So there's been enough trauma to her pelvis to wonder or consider whether or not there is enough compression of her pelvis by her muscular system for her to be able to do the tasks she needs to do to look after these 2 young kids. So let's have a quick assessment of Caitlin's standing posture and her ability to handle loads through her trunk to see whether or not she needs, number 1, the Maternity Support Belt by Diane Lee, or whether she needs more training of the muscles around her pelvis in order to make her day a little bit easier. Okay, so Caitlin, just turn to the side for me now. So there are 2 very common postpartum postural patterns we see, and Caitlin certainly has one of them. And it's a posture that's called the sway back. So her pelvis is forward of her feet, so she's anteriorly swayed, and her pelvis is also a little bit posteriorly tilted. And in response to that, her thorax has gone into an anterior tilt or a flexed posture. Okay? So one of the first things that we would want to do for Caitlin with this is to advise her as to why this is perhaps not the best posture over a long period of time and what she could do to work on changing this. And it sounds simple, but to change it is not easy. Okay? So what Caitlin needs to do is bring her pelvis back over her feet, gently lift the sternum, and then to practice this standing position frequently during the day when she's folding laundry, waiting for the kettle to boil, standing teaching. She's a teacher. So if she can pay attention to her posture when she's standing, and this can become home for her, as opposed to relax and go back to where you normally do, as opposed to being here, over the long run, she's going to support many things in her core in a lot better way for her long-term health. Okay, so that would be my postural assessment of Caitlin. Now, how well is she able to transfer loads or manage loads, and how well can she lift her children in her postures that she tends to use? So just turn back for me now, Caitlin, this way. Okay. And we're going to do a butt back squat. So come down into your butt back squat for me, like you were going to lift your 2-year-old. And I'm going to be the 2-year-old. Don't let me push your arms down. And you can see she elevates her shoulders, she flexes her thorax more, and I can break this. In other words, I can beat her very easily. Okay, so come on back up. All right, so let's see now if adding more compression to Caitlin's pelvis will make this task a lot easier for her. So to do that, I need some assistance. So I'm going to use the Maternity Support Belt by Diane Lee to apply the compression to her pelvis and then retest how strong she is in the squat task. So now we have the Maternity Support Belt by Diane Lee on. Let's see how strong Caitlin is. So let's go into a butt back squat, arms out. Don't let me push you down. So clearly you can see that Caitlin is a lot stronger with more compression applied to her pelvis. So what is her pelvis lacking? What does she need to train or to do in order to be as strong as she is with the belt on without the belt? So that's going to require further assessment of the muscles of her pelvis, which we will do now. So what does Caitlin need to train to bring back more compression in her pelvis when she's transferring loads? We can use the active bent leg raise as a test to help us determine which muscles she needs to train. So Caitlin, what I want you to do is think of nothing and just lift your left foot up off the table and back down, and lift the right leg and back down. So do you notice any effort difference in terms of lifting one leg or the other? Is one leg harder to lift than the other? The left one is harder. And if you watch what happens when Caitlin does this, and I actually place her hands over her pelvis, not for support, but just for awareness, lift your right leg, and her pelvis doesn't move that much. But when she lifts her left leg, and back down again, and don't lift it as high, just to 90, go again. What you can see, hopefully, is that her tummy bulges, her pelvis rotates. Can you feel that, Caitlin? Compare it to this side. Yeah, it's a different strategy. She uses her back extensors more when she lifts her right leg. She doesn't use her core muscles that well when she lifts her left leg. So neither are optimal, but she's using different strategies. So now what happens if we give her more core support with some specific cueing of the deep muscles of her pelvis? So Caitlin, I want you just to sink your fingers into your tummy here. And we know that the pelvic floor should be reflexly connected to your deep abdominal transversus. So let's start with a pelvic floor cue. I want you to think about tightening the muscles, first of all, around the anus, back passage. Don't fart, perfect. A little less hard than that. Go again, just a little less. There you go. And now squeeze around the urethra, like to stop the flow of urine. Perfect. Keep that. Now lift the left leg and back down. And what do you notice when you do that?
It's a different experience. It's easier.
It's easier. Yeah. Okay, so we know that if she had more compression at the front, that it would make it easier. And the belt already told us that. What about multifidus? I slide my fingers around so they're just medial to the PSISs or the medial to her innominates and on the sacrum. And then I ask her to imagine that there is a line between these 2 points. And I'm poking into the multifidus muscle on each side. And what I want you to do for me, Caitlin, is think about a force that would draw your pelvic bones together at the back, gently. Perfect. Keep that. Now lift this leg and back down. Better, worse, no change.
I can feel a difference. It's
yeah?
Better. Yeah?
And is it more or less better than when you did the front?
I think it's more better.
More better? Yeah. Let's combine the two. Let's start at the back. Add your pelvic floor. Keep both of them on. So now we've got pelvic floor TA and multifidus. Now lift this leg. Beautiful. No movement in her pelvis. Did it feel any better than just doing one of those?
It does.
It does. All right, so she needs all three. So her connect cue for stage 1 training is going to be to bring all of that together, and it's going to look like this. So you cannot strengthen a muscle your brain isn't using. So in stage 1 training, we have to reconnect these muscles to your brain, all right? And this is really hard on your brain, more so than it is on your body. So connect at the back, contract the pelvic floor, keep that, float the leg up, hold it there. Now let the connect cue go. And what do you feel when you let it go? Felt everything go, and what happened to the weight of the leg?
It gets heavier, like it gets down.
Exactly. So that's the home awareness piece for them to know, am I doing this exercise properly? Because sometimes the exercises don't seem like much, but they are a fundamental part and a very important part to be training before we move on to stage 2 strengthening or capacity training. So what's the dosage? How often do we ask Caitlin to do this exercise? And how long do we get her to hold the leg up? And how many times a day do we get her to do it? So the dosage really depends on how tired she is and how well she can do each set. But the goal is to get to 3 sets of 7-second holds with a 2-minute rest in between, and to do that 3 to 4 times a day for at least 1 to 2 weeks. Then we can see if she's ready to progress into stage 2 training. So after 1 to 2 weeks of practicing the stage 1 recruitment and loading of these muscles, Caitlin should be ready to move on to stage 2 training. But we need to assess, first of all, to see if she is. So, Caitlin, what I want you to do for me is connect to the back, the bottom, and the front. Lift the leg. And how fast she's able to put that all together will tell you and tell me how well she's been doing her homework. So if she can put that together really quickly, then she is ready to move on to stage 2 training and to add an increase in the lever arm. But before we do that, we have to make sure that she can integrate her breath or her breathing pattern, because we don't want to train a strategy that is only about holding your breath, all right? So it looks like this. Caitlin, I want you to take a nice small breath in. As you breathe out, connect. Back, bottom, front. In again. So we exert on the exhale breath. Exhale, back, bottom, front, float the leg. And back down. This time we're going to extend the leg. So breathe in. Exhale, connect. Float the leg. Then extend. Inhale to bring it back in, and slowly put it back down. So if you run out of breath like you did, okay, that's okay. Just hold the position. Inhale to hold, exhale to exert, all right? Always make sure that you've connected before you move, okay? So one more time. Inhale, exhale, connect. Don't lift. Now lift. Inhale to hold. Exhale, reconnect. Extend the leg. Extend the leg. Bring it back in. Inhale. Exhale, connect. Put the leg back down. All right, so there's lots to think about there, right? And it's more like tummy tubbing, tapping, head rubbing. It's a brain exercise, right? But it's also adding load and training capacity and strength for these muscles. So how many do you do and how often? This is where it's really important that you don't prescribe a number or a set. Because if they're doing it at the end of the day and they're tired, they may only be able to do 3 or 4 really well. And I don't want them doing 10 or 12 because I told them to do 10 or 12, and 8 of those are in a non-optimal way. So they need to use what we call the load effort task. So how hard is it to lift this leg? To know that whenever the leg goes heavy, whenever you feel your pelvis start to rock and roll, you stop, reset, and then do the whole thing over again, okay? Because it's about quality, not quantity. And when you can get to 3 sets of 7 of these leg extensions before you put your foot back down, then we are ready to move on to something that's a bit more challenging. When you feel that you connect and lift the left leg, it's as easy as connect and lift the right leg. Then you can start doing this exercise one leg at a time on both the left and the right side. Because to do it with both legs lifted is a big step. It's a much higher load exercise. Yeah? Watch this. Connect, back, bottom, front. Float this leg up. Lift this leg up. Yeah, and you can see the Valsalva, you can see the push down, right? So it's a big step to get to here. So let's not do 2 legs, let's do 1 at a time. And then you would then see the person again in a week or 2 to see whether they were ready to move on to more difficult and challenging stage 2 exercises. We're not moving into stage 3 yet. So this is another stage 2 exercise that is really useful for most postpartum moms who have to do a lot of lifting in both a short lever arm and in a long lever arm to place baby into the crib, into the bath, into a car seat. So to set up for this exercise, you're going to need a long resistance band. You place it underneath each foot, having the feet a little bit wider than hips width apart, or whatever distance wide is comfortable for them to do a squat. They hang on to the band at whatever level they need to give them the appropriate resistance for their biceps curl. And you may not know where that is until they get into the squat, so you can move your hands up and down the band as needed. So starting in the standing position, first of all, we would correct the standing posture. So pelvis back, thorax lifted. Okay. Then we do stage 1 connect cue. So connect to muscles in the back, the front and the bottom, which should be pretty easy by now. And now we have her go back into a butt back squat. Good. And then just to check in, make sure this hasn't collapsed, but you're leaning forward a little bit. Perfect. Now we're going to get Caitlin to choke up on that band as much as she needs to. And the exercise starts with staying connected, and we just do some biceps curls. Now, for her to know if she's doing this correctly, hold your arms up here, shut the connect cue off, yeah? And immediately, what do you feel?
My arms went.
Arms drop down because her thorax dropped down. Okay? Come on back up. Reset. Connect. Butt back squat. So you're changing posture, you're changing position, you're training core connect cue. Let's integrate the breath. Small breath in. Exhale, connect and pull. Inhale, release. Exhale, pull. Now, her progression for this, and she's going to find this a bit hard, bilateral, both arms out. Whoa, and she's not ready for that, right? Not ready for that. Because you saw right away she lost her shoulder girdles, lost her thorax. So again, just like a double leg lift is really hard for Caitlin right now, So is a double arm lift, but her child needs double arms for lifting. So you want her to progress as quickly as she can to lifting that band further and further out. And maybe she chokes up a little bit higher or moves her hands up higher on the band and finds the resistance that she can meet without losing her alignment, her biomechanics, or her control. So connect, butt back squat. Really just sitting into it. Nice. Stay lifted. Now, come up onto the band a little bit. See what that feels like if you take both arms out. Yeah? Now, come down again. Circle your shoulders onto your back. There. Keep that. Only move here. Better, better. As soon as you feel your shoulders start to lift and go forward, it's too much. Okay? So how often does she do this? So frequently to start with, so it's not a high-load task. I think she can do this 2 or 3 times a day, and the number of repetitions that she will do is as many as she can do holding it all together. So it may just be 4 to 6 repetitions. Stop, repeat, try again, see if you can do another 4, stop, see if you can do another 4, okay? So the more you can practice, the more you can build up not only your strength, but your endurance for this. And every time you're lifting your toddler or your baby, do it this way, okay? So think of this not like an exercise, but more like language, that you're training your body to do things in a different way, and soon it will become automatic, okay? So that's still stage 2 training. We are training control, strength and control, but we are not adding movement of her pelvis and her thorax at this stage. To move into stage 3 training, we'd be doing things like walking lunges or things where the pelvis is actually moving in space. And a lot of these exercises are according to whatever it is that the mom needs. And so you prescribe the exercises according to where their deficits are and to what they need. But as soon as you're starting to rotate the thorax on the pelvis or move the legs in a way that the pelvis twists, you're now moving into a more complex exercise, and we call that stage 3 training.